Hey guys, welcome back to Kid Medic, and today I will be teaching you all about dermatology and basic surgeon skills. So let's get into it. So first of all, you always want to be gloved up. That's an essential. So yeah, first of all, we're going to remove our suture pad, and we're going to go over some basic medications everybody should know. So first of all, I'm not a medical licensed doctor, so I'm just giving you the information about what these are. I'm not telling you to administer these. This is lidocaine. Lidocaine is a local anesthetic. This one does not have epinephrine in it, and this one's expired, so I would have never used this. So this is just lidocaine right here. Numbing. If you're about to cut somebody's skin, it's always good to give them a little bit of this. Maybe we'll show how to apply that later. Bupivacaine. This one has epinephrine in it. Bupivacaine is a long-lasting local anesthetic. Or numbing thing. So yeah, that's what bupivacaine is. And then there's xylocaine, which is just lidocaine with epinephrine, so it can block the blood vessels to stop the bleeding a little bit. That's why they add epinephrine to this. So this is xylocaine. Next off, we're going to talk about some basic creams like triamcinolone acetonide. This is triamcinolone acetonide is like a steroid cream. It's if you have really bad rashes, eczema, anything like that. But yeah, it's always good to have this. It's like if you have really bad skin or something like that, it's good to have. And triple antibiotic ointment. If you don't know, the actual ingredients in triple antibiotic ointment are, I forget how to say it, so I have to look. It's a bactration zinc equivalent to 400 units of bactration. Neomycin and polymyxin is actually triple antibiotic ointment. That's what triple antibiotic ointment is. I had to read it because it's hard to remember those names because they're really long. But yeah, that's triple antibiotic ointment. Then we have this is good. So if let's say you're about to apply local anesthetic and they don't want to feel the pain of the needle, this is good. If you have Ubernum, it's a 5% lidocaine, which is a very strong lidocaine. You can rub it on there, and it's lidocaine cream, and then it'll numb it, the epidermis layer of the skin, so that they don't feel the needle going in. Next of all, we're going to talk about the different routes of vials of medication. So I have two right now. This is a vial, where you'll take a syringe and you'll stick it in the top, and I'll try to do it with this one. And then this is not any real medication. This is an ampule. I'm not going to crack this, but basically what you do is you put a piece of gauze around the top, and then you'll crack it in half. This is an ampule. And what you'll do is crack it in half. This is fake. This is nothing real, but you'll take it and you'll just crack the top off and you'll drop the medication like that. So first of all, I'm going to show you how to drop this. Let me get an alcohol wipe. I have one. Oh, I don't think I do. Okay, I don't have an alcohol wipe. So basically what you'll do is you'll wipe off the top of this vial. And you'll take your syringe. There's no one. I forgot to tell you all about the different size syringes. So this is there's a bunch of different size. This is what size is this? This is a normal size. I think that's a 18 gauge, and then this is a 22 gauge syringe, and then this is a hypodermic needle. That is a 18 gauge. This is an 18 gauge hypodermic needle. So then, this is this one's a 20 gauge, this is a 22 gauge, and this is an 18 gauge. And the smaller the number, the bigger the needle. This is a 10 ml syringe without a needle, and this is a sampling swab or a cotton applicator, whatever you want this to be for. I'm going to use this as an applicator. But first of all, I'm going to show you how to drop the medication and locally anesthetize with a 22 gauge needle. So the way to open your needles is you go like this. Boom. Pop it. And now remember, we want to do our best not to touch this little part right here, because that part is sterile. So what I'm going to do is I'm going to take out the cap carefully. Sometimes I have to screw it all tight. So there's the needle right there. I'm going to draw a little air in it. Now I'm going to take my vial, and I'm going to make sure my medication is not expired, just as this, because we're using this for training. And I'm going to make sure that it is the right medications. I'm going to hold my vial upside down. Y'all won't be able to see this. I'm going to take my needle, and I'm going to go in like that. I'm going to push the air in. Now that the air's in, it's going to draw up a little bit on its own as I'm going to draw it up. I'm going to draw about that much. Next of all, you don't want to put air in the syringe. So what we're going to do is we're going to thump it, and we're going to squeeze a little bit out and thump it. Alright, now the syringe is ready to go. You see how it's no air bubbles in it? And it's completely clear. It's see-through, no air bubbles. That's what you want to see. And you don't want to see any floaties in there, like anything floating in there. That means the medication could be expired acid. So, first of all, we're going to have 3 layers. We're going to call this top one the epidermis, the outer layer of the skin. Then the dermis, which is the inner layer of the skin. And then the subcutaneous fat. And then after that would be the muscle. So we're going to go ahead and I'm going to show you how to do an intradermal anesthetizing / injection. So you would have cleaned this, prepped it. You're going to go only in the dermis. And we're just going to locally anesthetize, you'll just push a little bit. Like that. And that's real good. It's an intradermal. It's very simple. You want to make sure your bevel is always up. You see that little bevel tip? That always needs to be up. And that makes it the easiest way to get in there. You can push a little bit. Now, to go in intradermis, all we're going to do is we're going to go down a little deeper. And we're going to push in a little bit. And then we can go down like that. To go all the way down to the subcutaneous fat, we're going to go at more of an angle. And push in our medication. Now, if you were going to go into the muscle, you would go to 90-degree angle all the way down like that. But yeah, now if you were locally anesthetizing, you'd probably do something like this. You'd probably get all the sides. You'd want to anesthetize all around to make sure that the patient is comfortable if we're going to suture this. Fortunately, I don't have any sutures, so I can't teach you how to suture. I will be buying some, though, just so I can teach y'all. And then you see, you would want to be moving it around, trying to get all the site injected with the local anesthetic. Just like that. But yeah, that's how you will do intradermal with a 22 gauge needle. Now, what would you use a 10 ml syringe for? Now, you can use a 10 ml syringe for irrigating wounds, cleaning up wounds, and all that. Next of all, I'm going to talk about calamine lotion. Calamine lotion is the calamine and zinc oxide. This is for itching on the skin, serious itching. So this is good to have if your skin's seriously itching. Calamine. Next off, we're going to talk about some basic surgical tools. First of all, I'm going to start off with the scalpel. So here's the scalpel blade. I'm going to teach you how to put the scalpel on. And here is the scalpel blade. And here's the scalpel handle. And I'm going to also grab my forceps. So what I'm going to do, make sure I have the right size blade. And this is number 3 and this is number 15. So those will fit. I believe those will fit. It's kind of hard to size these. Now, what we're going to do is you want to go ahead and we're going to open up the package about halfway down until we get about right there. Then what we're going to do is while grabbing it with the forceps so we don't clamp ourselves, we're going to push down and connect like that. And take it off. Now you got your scalpel blade on there. And now to hold the scalpel, we're not holding it like this. Not like this. It's nothing fancy. We're holding it like you're holding your pencil. And then what you can do is you can cut. You see, I just cut the dermis layer. I can cut the subcutaneous fat layer. I can cut all the layers with my scalpel. You see? Yeah, you don't want to dull your scalpel, but yeah, so that's how you can do with that. And now, basic surgical tools. These are forceps. These can grab things. These aren't sharp. These these hurt, but these aren't like non-crushing forceps. But these are just things to grab. Like I can grab the skin. I can lift up the skin. Like that. Those are, and then these are mosquito forceps. These are just tinier versions of these. Same thing. They don't hurt. And you can just grab the skin with them, just for tinier things. These are small surgical scissors. These are just used for cutting. With our forceps, like if we were going to cut something like that, we could take these, which are, I believe, Addison forceps or Merriam forceps. You can take this and you can pick it up and you can cut. And you can cut. Cut like that. You see, I can just pick it up and I can cut. And then if you want to make bigger scissor cuts, you can use these. These are the big scissor cuts that you can cut big things with, like that. Like if we were going to take off a big chunk, we could use the big scissors. Take off a big chunk like that. The next surgical tool I'm going to go over is Addison. I know these ones are Addison forceps. So, the thing about these ones is, you see, at the very tip, they're serrated so that they can grab things. So, if I did it to my skin, they're serrated. So, if you lightly touch it, you can lightly grab up your skin. Very lightly. You want to lightly do this, because if you poke too hard, you'll poke the skin. You see, I can lightly pick up the skin. But if I push too hard, it goes through the skin. And then that's not very good. So you see, it helps just grip. It grips a little bit better. Now, let's say we were about to locally anesthetize. I'm going to do a full lesson on it. First of all, here's how it's speeded up. Take your local anesthetic cream, your topical anesthetic. Put it on a cotton-tipped applicator. We're going to go ahead and rub it all over the area we're about to locally anesthetize with lidocaine or xylocaine or whatever you're using. As you can see, I'm rubbing the lidocaine all over where I'm about to anesthetize. So now that we have the lidocaine, this is called Ubenum. You can buy this at your grocery store. That's the best kind of cream, I believe. And now if we were going to replace, sorry about that, the needle on this one, if we were going to replace the needle on this, all we would do is we take this off, like that. We take our 18 gauge needle, which I'll show you how to do that one, and we'll just twist it on and off. And now as you can see, 18 gauge is pretty thick. So we can dry our air in, upside down, air goes in, and then we pull, remember we pull in the liquid that we need. We get the air out. And now this one's a big needle, so you're going to go ahead, and this one would probably hurt a little bit. I'm going to go all the way to the subcutaneous fat, and that's locally anesthetized. We're going to squirt a little bit. We're going to come up, and as we're squirting, we're going to come up slowly. And then we can also do something where we stay